Welcome to the Pharmacy Quality Solutions Quality Corner Show, where we talk quality of healthcare and explore what that actually means. Let's dig into performance measurements, the Equip platform, pharmacy goals, and personal goals. We will also occasionally cover topical healthcare news and maybe throw into the conversation a few of our own nerdy passions and hobbies. So turn us up. The Quality Corner Show starts now.
Hello, and welcome to episode 32 of the Quality Corner Show. I'm your host, Nick Dorich, and today I am pleased to have one of our PQS co-hosts join me today. Let me reintroduce Cora Eilders. Cora, welcome to the show. How are you doing today?
Hi, Nick. I'm doing very well. I'm really glad to be back on the show today and excited about the topic that we are able to discuss.
Excellent. So, Cora, thanks for coming back on the show. Today, we do have a special reason for having you as one of our co-hosts, and that is to help us introduce another guest to the show. So let's go ahead and have you introduce our partners that are joining today's podcast.
Yeah, Nick, that is absolutely correct. I'm very excited to introduce one of PQS's committed partners. Today, we're going to be talking about some of the new performance measures that will be hosted within the Equip dashboard. And this seemed like a great opportunity to introduce our partner that is the first to host these measures within Equip. So without further ado, let me introduce Sarah Dean from Humana to help us talk about these measures and kind of the initiative that they are taking to work proactively with the pharmacists to manage and improve patient health. So Sarah, welcome to the show.
Thank you, Cora. I'm happy to be here and talk about this exciting initiative that we are working on together.
Cora, thanks for providing the introduction, and Sarah, certainly welcome to the show. I'm excited to have you on board. It's always more fun when we get to talk with folks that are outside the PQS organization. Personally, I am very excited for this episode because it does display a shift and an opportunity for pharmacists to be more embedded with managing patient health outcomes. That's the reason we are all here, to help expand and promote the role of the pharmacist for managing patient health. So before I start to get too excited, let's get into today's questions. For today's show, we're going to do a little bit of a different format. I'll ask the questions for you, Sarah, to respond and explain a little bit more about the program and these measures. You can provide a response, and then Cora will provide some additional perspective from the PQS team. It's best for us to begin at the beginning as to why we are having this particular discussion on the podcast. So with our first question, it's going to tie into the reporting. And starting in June 2020, Equip will be hosting several measures related to hemoglobin, A1C testing, and the opportunity for pharmacists to assist in patient education and testing. Sarah, can you share a little bit about how Humana engages with other healthcare providers around quality improvement and quality measures?
Yeah, that's a great question, Nick. So through our Quality Network program and our STARS improvement teams, we put forth every effort to partner and engage with multiple healthcare providers whose care impacts our members' outcomes and consequently quality measures. And we utilize programs and models to help providers understand which members may have gaps in care or are performing below a quality measure threshold. The engagement looks different for different providers, settings, and quality measures, but we do use PQS as one of our main sources for engaging with pharmacies and pharmacists who impact our members' care and pharmacy-related measures. So like PQS, our goal is to mainstream the process for displaying data and tracking provider performance by setting clear quality performance goals. We identify which quality measures need improvement, along with which members can be positively impacted, and then track trends in measure performance throughout the year for those providers.
Yeah, and here at PQS, we really commend Humana on this approach of transparency and providing the pharmacists with all of that actionable good information in hopes to then improve outcomes across the board. So we're really thrilled to partner with Humana on these new A1C measures because they're kind of a unique opportunity to give pharmacists a line of sight into another diabetes metric of A1C. So we're really hoping that this can help bolster conversations that the pharmacists are already having and will continue to have with the patients by providing them with a little bit of an additional metric that hasn't necessarily been available in the past. So just really excited for that level of information sharing at this point.
Thanks for the description there, Sarah and Cora. It's important here to recognize that your organization engages in a number of strategies and outreach with patients for the pharmacy or members for you as the health plan to improve their health and help them live better lives. Your organization is taking a big next step by engaging the pharmacist here and now. Can you share the thought process that went into expanding this opportunity to pharmacy?
Yeah, that's right, Nick. So we know pharmacists have an important role in impacting member outcomes, and they're also well positioned to be able to communicate with members at a different frequency and in a different environment than the traditional prescriber. We know pharmacists are accessible and they're trusted, and they often also have insight into multiple touch points that a member may have within the healthcare system. Part of Humana's Quality Network mission is to leverage pharmacies to improve members' quality of care and resolve gaps in care, and then reward quality performance in value-based models. So one of the focuses of my team is to look for opportunities where we can expand the role of pharmacists in an effort to improve clinical quality of care, which is ultimately tied to improving STAR performance. And as we look forward to strategically developing our network, we recognize that pharmacists can provide valuable education and counseling, as well as point of care services that expand beyond just medication and adherence gaps in medication therapy. Further, we know pharmacists are trusted and have the ability to connect with members to better navigate the healthcare system and manage their conditions holistically outside of a physician's office setting. I really believe pharmacists are ready to engage in patient care at a higher level, so creating this opportunity with PQS is exciting to me, as we can demonstrate pharmacist value, help close member gaps, and provide value-based reimbursement for pharmacist activity that is outside of the traditional dispensing model.
Yeah, Sarah, thank you for sharing kind of Humana's intent behind this program. And I think really the engagement piece is key here. Kind of you alluded to how pharmacists have more frequent touch points with their patients and thus your members. So I think that this inherently will foster a sense of accountability when these conversations are being had around diabetes care and outcomes. And it really makes that engagement much more effective when it is so frequent. So I think that is a key point to understand, and really a key point as to how we can really prove that pharmacists as providers and really their value within the care team.
Yeah, absolutely, Cora. We agree wholeheartedly. That's definitely one of our intents of the project.
That's really excellent to hear. And Cora, thanks for the summary, and Sarah for the response. That's a perfect transition for us to move into our third and final question as part of this podcast recording. And our listeners know our third question is where we try to swing for the fences and provide the most meaningful content for our listeners. The pharmacy community has been calling for increased engagement with being an active member of the patient care team, and for the opportunity to both provide direct patient care services and to be reimbursed for those efforts. This opportunity here is just the beginning for pharmacists, but the expansion of this particular program and other opportunities for pharmacy are also dependent upon pharmacists showing that they can successfully lead these initiatives. With that long preamble from myself, Sarah, can you share your ask or your perfect vision of what success looks like for this partnership and how pharmacists can display their value?
Yeah, that's certainly a great point, Nick. And while I have the utmost faith in pharmacists' ability to be successful in this program, I will note that we do need them to prioritize the work and complete it successfully to really show the impact of their engagement. Our quality measure strategy is data-driven, so we need pharmacists to really buy into this opportunity and demonstrate not only that they can help address A1C gaps in care, but that they can also perform at a level that is consistent or even above what we already see through other providers and venues. We need to see that these efforts translate into a lift in performance and close gaps in the diabetes quality measures. So when I think about my perfect vision, I would say that regardless of opportunity size, and I know that for some pharmacies that will be small, it would be that they make every effort to exceed our expectations by addressing every eligible member, creating a positive member experience, and influencing members' diabetes care so that we do see that gap closure reflected in our data. And this will provide us the evidence that we need to continue to create and expand quality programs that reach more pharmacies and more members over time.
Yeah, and Sarah, I think you hit on a really key point there, kind of the intentionality behind every member, every time, and having these really thorough conversations with them about their diabetes care. And I think that that discussion, kind of coupled with the frequency that the pharmacist may have interactions with these patients or members, is really what is going to propel this program forward, and thus more programs potentially like it in the future. And so I really am encouraged and excited about what the end goal here is, and really hopeful that we can have that level of engagement within the pharmacy to make these things happen.
Excellent. And Cora, do you mind here sharing from our perspective with PQS and with Equip? We had referenced that these measures are, and that this program is going to be starting with June 2020. Do you mind giving a little bit of additional information, just when this is going live, what measures we are referencing here around A1C management?
Absolutely. So we're specifically looking at two measures. So the first measure is looking at, has a diabetic member had an A1C test complete within the year? And the second measure looks at those same diabetic members. Have they had an A1C test complete, and was that A1C test value under control? So through those two measures, we're able to then provide the pharmacy or the pharmacist with a little bit more useful and actionable information about that patient's current diabetic state, and just looking forward to those pharmacists being able to utilize that in conversation. So these two measures will go live within the Equip dashboard for particular pharmacies with the June refresh of Equip. And then subsequently, they will continue to be displayed through the end of the year and there forward. So for this program specifically, Humana will be providing weekly updates to try and make sure that that data is as actionable as possible and really engaging for the pharmacists.
Fantastic. Thanks for the additional context that's here. I know pharmacists and pharmacy technicians and others that are listening and utilizing Equip, they'll want to know and see some of that information once it's available. So that context is fantastic. We look forward to pharmacists really digging into that information. So Sarah and Cora, I want to thank you both for the conversation today. This is really a great opportunity for us to share and to be a cheerleader for the opportunities that are coming to pharmacy. I am personally excited because I know this is a role where pharmacists have the training and education to produce results. Pharmacists have the patient touch points to produce results, and pharmacists have the communication skills to produce results. We did mention this at the start of the program, and that Humana engages with many partners to help improve quality measure performance. Sarah, I therefore have one final question for you, and it's not specific to diabetes management or A1C under control. But from your perspective, what can or should pharmacists do with patients or with payers like yourself to help promote these types of innovative approaches?
Yeah, I will go back to my earlier statement and then would say demonstrating your value and engaging in a program when it is offered is so essential to advancing the practice of pharmacy and creating further opportunities for reimbursed member engagement. And one of the best things I can see from my position is a pharmacy who takes an opportunity and really dedicates themselves to performing at the highest level. When we see that across the entire pharmacy network, it creates a great case for giving pharmacies more responsibility and opportunities for improving member outcomes in a holistic manner through different programs that a payer like Humana might be able to offer.
That's a really great point, Sarah. And we share that kind of vision here at PQS. It's always exciting when we see pharmacies set goals and go about improving metrics with intentionality. I'll go back to that word I used previously. That really is what we see drive results in the end game. And so anytime that we're able to see that and then thus have it be demonstrated with improvement in metrics on the back end, it's so exciting, and it makes more programs and things like that able to happen. So
absolutely. Cora and Sarah, thank you both for joining today. Cora, it was great to once again have you on the show. And Sarah, I appreciate you joining on the podcast for the first time. And I say the first time, hopefully we'll have another opportunity for you to join in the future and talk about the success that pharmacies have with programs like this. The conversation was very enlightening, and while we explored some current opportunities that are going to be available for pharmacies, it's also important for us to point out that we discussed action items. There's always this double-edged sword of having to perform or execute with current opportunities, but also preparing for a future state. I think that with the help and with the commentary from Sarah, we effectively did that today. That gives you, our podcast listener, plenty to think about to optimize your pharmacy, your workflow, and how you work with patients. That actually sounds like some great topics for a further exploration with another podcast, but we're going to put an ending on this episode of the Quality Corner Show. So until next time, our team here at PQS has a couple of favors to ask of you, our podcast listener. First, we encourage you to share this podcast with 2 friends, because if you share this with 2 friends, each of them shares it with 2 friends, it really helps us hit a larger listening audience. Second, we also want to take a moment to remind you to subscribe to the podcast wherever you may find it. And then, if you have any questions or topics you would like us to address, please contact us. The best way to do so is to email info@pharmacyquality.com. Let us know what is on your mind and what we can address so that you are fully informed. Our goal is to continuously improve our podcast content and to provide meaningful information to our listeners based on the current topics in healthcare, technology, and quality measurement. We want to help you become as effective as possible in how you care for patients and improve public health outcomes. So until next time, we wish you well.